Welcome to From the Front Line, Surgeons' Voices for the ACS Bulletin Brief. With me today is Dr. Harry Keshava, who has just completed his fellowship at Memorial Sloan Kettering. Congratulations, Dr. Keshava.
Thank you very much. Thank you very much, Dr. Wexner.
Very great to have residents and fellows engaged with what we're doing in advocacy at the college. Many people say, well, I don't think I can do anything at this point in my career, or it doesn't apply to me. And you're a shining example of how those statements are patently false. So I'd like you to start out by telling us a little bit about yourself, just your background at Memorial Sloan Kettering and your future at UC Irvine.
Sure. So I just finished my thoracic surgery fellowship at Memorial Sloan Kettering, and prior to that, I was at Cleveland Clinic in Cleveland doing my general surgery residency. In my future, I'm actually going to be headed out to Southern California, taking a faculty position at UC Irvine in the Division of Cardiothoracic Surgery. I actually specifically got involved as a resident, as a resident in Cleveland, and I think that's one thing that it was fond, or that I saw really quickly, and the college really supports residents getting involved. So I think I was a PGY3 when I first got involved with the college, and then specifically with advocacy.
What or who got you involved in advocacy at that level of residency while you're at the Cleveland Clinic?
Sure. It was actually interesting. My road to advocacy actually came a little bit circuitously. I just remember as a junior resident having to IND many abscesses. And that actually came from people that, especially in Ohio, that were using heroin or opioid epidemic. And from then I started reading and getting more involved. And I realized that this was actually a higher level issue, not just what we're doing on the ground. And I saw that some of the legislative problems that came about that actually caused that epidemic. And that's actually how I got involved. And then as a PGY3, I applied for the grant that they have for residents to go to the Leadership and Advocacy Summit. And that actually kind of spawned everything. I met a lot of people that were involved, both at the resident level up to ACS regents and board. And I realized, you know what, this is a huge impact we can do, even as residents getting involved.
Could you please give us some examples of what you can do by being active in advocacy? Perhaps you could cite a couple of specifics, either from that Leadership and Advocacy Summit or subsequent to that time. Sure.
So something that I think every resident should get involved in, at least go to once, is the Leadership and Advocacy Summit. Just because, especially in pre-COVID times, and I'm sure once we're able to get past this epidemic or this pandemic, we'll be able to meet with congressmen, senators, and their staffers, in which we have done, which I have done as a resident. And I met with many of the Ohio senators and congressmen and their representatives, which has been crucial in having a resident voice. They actually want to know about graduate medical education, resident issues, moving forward with job placement, and how we actually train. And we can bring that voice right away into the conversation when we meet with these staffers.
So when you talk to residents and fellows, what do you tell them? What's your elevator pitch as to why they should get involved in advocacy?
It's one of those things, I think, that everyone talks about it. We hear it at dinner table discussions or just discussions, especially times like this when we're in an election year. But I think not many people just are out there kind of realize that we can actually have a voice. They say, oh, this should change, that should change. But then once they say, oh, how do we do that? What can we do? That's where I kind of tell them, hey, we actually can have a voice. We can get involved. We can actually change what our voice is as residents. And when we change our residents' voice, that's when leadership in the ACS, as well as leadership in our country, kind of start listening. They start hearing our voice with issues from COVID and PPE, from job placement now, especially during COVID times, to graduate medical education, and how that actually affects our training and what we do in the future. So I tell them, like, kind of get one specific issue and see where we stand in the college and how we can, and where we can, what we can do about that as residents.
Excellent. That's very, very good counsel to give people. How about when you're speaking with your faculty? So it's one thing to talk to other residents who are at your level, perhaps under your level, not as high along in the training sequence. But what kind of experiences have you had speaking with your faculty? Have you been successful in getting them engaged?
I think the faculty is a little interesting. They actually like to hear how I've gotten involved and what I've done with going to the Leadership and Advocacy Summit, and even in the SurgeonsPAC and HPAC. That being said, it can be kind of tough. They have certain views on issues maybe that are not what we think as residents, or not what the college thinks. And sometimes you just have to educate them, be like, hey, this is what the future is. This is where the future is going. And a lot of the faculty are very supportive. They understand what we're trying to do, what the college is trying to do, how we support our patients, how we support surgeons, and how we can perform our job to the fullest. And I think they are actually very excited when someone like myself, who's a resident looking to do academic surgery, is actually involved in this, because not many times, not many surgeons, not many fellows, residents are interested and don't want to get involved, and don't think it's not the appropriate avenue to use what they can bring to the table. But it's something that I enjoy, and I think it's my faculty see that when I have brought that up.
I'm certainly glad that you're participating as actively as you have been in advocacy and with the ACS. I'm sure you're going to make many meaningful contributions after you've started up at Irvine. I look forward to interacting with you, and I hope that your enthusiasm continues to be infectious to others, because we need people in training and an early career to be engaged and to be involved. I agree with you. We can make a difference, but if people just shrug their shoulders and do anything, it won't happen. What do you think are the most pressing issues right now? When you get out to California, you tell people, listen, this is why you have to get involved. Just point one or two, what are they? I
think especially as a resident or a trainee, there are actually a couple issues that I think are very important. First and foremost, I think is our education, and then our future, what we do for job placement. I think we saw that specifically with COVID, and how that can really affect our training as surgeons. People got changed and they became ICU or COVID doctors, and how we, especially as surgeons, can do that. We can adapt to the situation, and we show kind of our value that we bring. And then of course with job placement, I think that is something that is crucial now moving forward, is how we can bring that value added to a group that we were to join, whether it be in academia, private medicine, private practice, or surgical group. I think those are really huge, important issues. And then moving forward, I also think, I've always thought graduate medical education is a big deal. It's a big ticket item in Medicare, in the VA budget. It's a big ticket item for many hospitals. It's how we get trained. It's essentially going to be the future. It's necessary. And of course, because it's a big ticket item, a lot of legislators, a lot of people out there always look at it and see, well, why are we spending so much? What does that mean? I think that's where we come in, especially as trainees. We can bring that voice. We say, hey, this is what we're doing actually right now, and this is the future. We're actually going to be doing surgery in a rural area, or like myself, doing lung cancer or esophageal cancer surgery, or going to the military, etc. And there's a lot of areas that we can show what we do and our relevance and our value added. Thank you once again for your time, your insights, and especially for your enthusiasm. Thank you very much, Dr. Wexner. Thank you.